Hi, True Family.
Hello.
Hi, Dr. Bitner. How are you?
I'm good. How are you? We had a great day working together, and I look forward to now talking about sleep with our true audience.
Yeah, I always love this phrase like wake up and talk about sleep, right? Because it can
Right.
sometimes make us feel a little sleepy to talk about sleep.
Exactly. And I thought about having a cup of coffee, but no, I'm good. I slept well last night. I'll be just fine.
Well, great.
And and the meal that I just had was not high in sugar or simple carbs, so I shouldn't get sleepy either because of what I ate.
and you're following your seeds, Dr. B.
Most of the time.
Most of
Everything
the
in
time. Doing
moderation.
our best. That's right.
That's right.
Well, I think our True Family may be a little surprised to find out that you and I don't agree always on everything, but there is
Yeah.
one thing that I think we wholeheartedly agree on, and that's making sure all of our patients get enough sleep.
Exactly. And I love how you, from your world of internal medicine and obesity medicine, and me from OBGYN and menopause and midlife, like we're coming together with different perspective. But yes, for sure, this is
And
what we agree on.
yeah, and I think that it's one of those things that I think about, all the my babies and thinking about babies, and even when we start out so young, like sleep is such an integral part of our lives from the very, very beginning. And slowly over time, we sort of unprioritize it, right? And I think a lot of the times it starts, we see young ladies that are in high school and in college, and I know I cringe when I hear how much time that they sort of take away from sleep to prioritize studying and socializing. And, that's just sort of the beginning.
Yeah, it seems like sleep is like it's what I'll do if I have time. And when do we ever have time? Never,
Right.
right? So it's the one thing that you think is optional. And friends, I'm here to tell you it is not optional.
Yeah. And I think then it almost gets worse as we see, new mothers, the young moms, right? Like, of course, they just can't sleep because of having a newborn. And then it almost becomes the normal, right? That, okay, well, I didn't sleep then, so I don't really need to sleep now. And we learn to kind of live in that brain fog.
Right. And I remember, even when I was delivering babies and up all night and I would sleep and think, I'd wake up refreshed and think, oh my God, this is how you're supposed to feel.
Right.
But what
Yeah.
I love what we're going to talk about tonight. It's more than just, oh, I feel good. It has so much to do with our health.
Yeah, and I think even from an internal medicine standpoint, it's sort of the big question of why do we need sleep? And I think that it's really funny to even think about we're not as, doctors 100% sure of everything that happens when we sleep, right? Because there's a lot going on. We know we think our brain is quiet, but it actually isn't. And there's a lot of processes and functions that are happening while we sleep that we desperately need.
Yeah, I love, I read a paper, it was last year, published in Science about how the brain sort of like the tissue expands and little cells go up and clean out the trash, essentially, pick up the trash at night. And so it's like we maintain the pathways that we use a lot and we get rid of stuff that we don't use a lot. And so if we don't sleep, we don't get that brain cleaning. I know that sounds pretty vague, but it was very intriguing.
Yeah, and I think that we now know that there's a lot of, when we don't sleep, our risk for some of the big guns, right, go up. And it's hard to know if there's an exact one-to-one correlation, but we definitely know with big risk with cancers, dementia, vascular disease, those big diseases are linked to not having enough sleep.
Right. I remember once I gave a talk and a woman who was a CEO of a company and she was, super busy and very successful, traveled all over the world, did very well. I remember she raised her hand and said, well, how am I talked about sleep and weight and sleep and psychological well-being. And she said, well, how am I supposed to sleep and still be so
Life,
successful? I'm
yeah,
like, choices and consequences, right?
right.
So it's a challenge to find that balance sometimes.
And it's funny because people sort of present that as if it's a one-to-one, but the reality is when people sleep, they're higher functioning. They look at sleep levels in athletes, and the athletes who get, from day to day, if they've gotten more or less sleep, tend to function better, are faster reflexes, thinking quicker with more sleep than less. So in some ways we think that we're cheating our job out by not getting enough sleep, but in reality we may be not, preventing ourselves from accelerating at work.
Right. And be able to function much better. And as we get into this, so many things that women care about: weight gain, fatigue, brain fog, and menopause symptoms. It all goes back to sleep.
Yeah. And I think one of the reasons why we overlap is because we know that there's this big relationship between sleep and weight. And that's, pretty clear from a variety of different studies that have looked at it. We're going to show a graph here and looking a little bit at, so this is from one of the women health initiatives, but it's looking at, patients, women over years of their weight, and it's broken down by the hours of sleep that they got. So as you can see, the top line is women who slept only about 5 hours a night on average. And you can see that their weight gain over, 20, 15 years or so really goes up quite quickly in comparison to the bottom line, which is that sweet spot of 7 to 8 hours.
Mm-hmm.
And we see this pretty correlates with other sort of studies where we look at weight gain and sleep. And, so this is looking at total time of sleep, but we know that there's much more than just the total time spent sleeping and the correlation with weight.
Right. So it's all about what's really interesting. I was at a conference this last weekend, and Dr. Fabian from Mayo Clinic gave a lovely talk on sleep and talked about how total sleep time doesn't necessarily change across the menopause transition, but it's the interrupted sleep that changes, or the sleep quality that changes. So it's really important to think about not just how long we're in the bed, and how long we might be sleepy, but what is our quality of sleep?
So, I think in translating that, I think that means that your night sweats really matter, not just like they matter because they make you feel bad, but they matter because they're creating a downstream effect that could lead to further weight gain, metabolic disease, and sort of other things that are going on. So ever more reason why we speak so much about talking to your physician about if you're having night sweats, what does that mean, and what we can do to treat them.
And even, I know you'll talk about it, but even like sleep apnea or these sleep disorders that happen, it's a big deal. It's not just annoying the fact that you're snoring. So again, I know you're going to go into this, but it's really interesting to think about what are the different reasons we don't sleep well.
Yeah. So let's dive a little bit deeper. So why is it that when people aren't getting good enough sleep, that it leads to weight gain? And there's a lot of different theories kind of behind this. And again, I feel like I say this all the time, but it is a little bit of a chicken or the egg situation. So you got to remember, when we're not sleeping, that leads to different mechanisms of our brain that sometimes lead to us making poor food choices. And some of that's not just because our personality changes with not getting enough sleep, but there's actual different hormonal changes. We have a quick bubble graph that will pop up that kind of presents this a little bit more elegantly. So, the top line and bar, has to do with two hormones that leave our GI tract and our fat cells. So our fat cells make a hormone called leptin, and they're supposed to, that hormone is supposed to tell the rest of the body that we have a lot of fat that's there, so we don't necessarily need to be hungry, right? And ghrelin, it leaves our stomach, and that's also supposed to tell the rest of our body, hey, we just got a big stomach stretch, right? We don't need to be hungry. So as you can see, that's the opposite. Ghrelin is supposed to tell our body that we should be hungry, and it goes off when we get a stomach stretch. So you can see when we don't have sleep, right, leptin goes down, ghrelin goes up, and that leads to just being more hungry. I definitely can attest to this, and I'm sure Dr. B can too, right? Those nights that we were on call, up all night, that next morning, man, I felt like I could eat a horse, right? Like I was just so hungry. Nothing seemed to satisfy those cravings. And it really kept going on and on.
Right. And also, not only that there's an increased hunger, but that people who are sleep deprived tend to crave more high sugar foods. So I saw a study where a bunch of guys were kept up for like 4 nights in a row, and they got up the next morning and they put them in a room with, bacon and eggs and whole wheat toast, and versus over here with the donuts and the pastries. And of course, what did they go toward? They went for the simple carbs. So there's a significant effect. And I think,
I talk a lot with our patients about, kind of our ping to eat and understanding where our call to eat comes from. Right. And so rarely do we get a hunger signal for donuts itself. That's more of a craving. And there's this constant balance in our brain of saying, oh, I should eat this, or no, I shouldn't. And we don't get enough sleep. I'm going to eat this kind of overrides the logical voice that's in our head. That's like, well, no, I want to be healthy and I'm trying to lose weight. That kind of just goes by the wayside. And then our craving becomes so powerful that we end up, eating the things that we wouldn't have necessarily eaten if we would have had a full night of sleep.
Mm-hmm.
So that's one aspect of why sleep deprivation can lead to weight gain. The other one is you have to think back to why we gain and lose weight. So remember, our brain's the one making that decision, right? Our brain is sending signals to our fat cells that say grow, shrink, maintain. And when we don't get enough sleep, there's sometimes a shift in some of that signaling that can shift us into either a weight maintenance or a weight growth state with changes from our pituitary and hypothalamus axis. That's the most primitive part of our brain. It's trying to run things and keep things functioning. And when we're not sleeping, the brain's sort of like, well, I guess we're not functioning appropriately, right? And kind of odd things happen.
Right. And I almost think about it too, like we're just in survival mode. So when we're in survival mode, our body, I guess the simplistic way to think about it is we want to store fat for later because we're in survival mode. We're stressed out. So with that stress response becomes fat storage.
Yeah. And lastly, then a lot of the times we can change the way that our body uses energy efficiently, right? So our body's allowing our muscles to work and to shunt sugar to our muscles efficiently. But if we're in a stress state, right? It's our body's going to say, maybe our skeletal muscles are not the time to be used. So let's not work out. Let's not go for that extra walk, right? Let's just sit here and chill. And that feels a lot more comfortable. But unfortunately, that just leads to more weight gain, less calories burned, less sugar used up.
And sometimes too, I think people think, weight is just this, all of a sudden this big occurrence, or it's one big thing to fix.
Mm-hmm.
And one thing I've really learned from you and how you talk to our patients is, it's just lots of little things. It's those little choices during the day. It's that extra portion. It's that. And so I think, to your point, when we're sleep deprived, it's just all these different little things that add up to significant weight gain. And most women gain 15 to 20 pounds right across the menopause transition.
Yeah. And I think sometimes it can be helpful to think about it as little changes because I know you and I both see this. So many women come in feeling just so guilty, right? Oh, I've gained weight and it's my fault. I'm just not strong enough. And we just know that that's just not true, right? That there's all these little things that have happened that are putting your brain into a position of eat more donuts, work out less, just store fat at all costs, right? That has really nothing to do with you and your personality. And that we know that you're trying really hard, but we got to fit these things back in order. And one of the best things you can do is start prioritizing sleep.
Agree. Couldn't have said it better. And hello to Vicky and Pauline and Stephanie. So please, everybody feel free to put questions in as we go. We'll see them and respond. If you're watching this after the fact, please feel free to message us and we'll get back to you.
Yeah. And so one of the common medical conditions that comes up that prevents people from getting adequate sleep, in addition to menopause, is obstructive sleep apnea. So obstructive sleep apnea is where we're unable to get air movement in and out of our airway. So normally when we're awake, we have muscle that opens up our airway and sort of supports the tube that's called a trachea. So we can very freely move air in and out from, the outside to our lungs. When we fall asleep, we lose that muscle tone. For the most part, for people who don't have extra weight that they need to lose, that's not enough pressure to completely close off our airway, and all is fine. And we have normal breathing, and that seems to not be an issue. But as we have extra weight that we need to lose, or if we have some other muscular issue that's going on, there seems to be a slight blockage when we fall asleep, lay back, and lose muscle tone. And that prevents the beautiful flow of air in and out of that trachea. And it can start to cause a buildup of carbon dioxide and a decrease in the oxygen in our blood. When this happens, of course, we don't die, but our brain gets triggered to wake ourselves up. And so we spend the whole night kind of getting startled awake, right? And then sort of falling back asleep. And then our oxygen dips, we startle back awake, right? And then we fall back asleep. And so instead of getting those beautiful hours of sleep that, 7 to 8 hours of sleep in a row that we need, we spend the entire time sort of waking up and never going through the cycles of sleep that we need. Of course, over time, right, if we if we have extra weight that we need to lose and we continue to have obstructive sleep apnea, you can sort of change the mechanics of your trachea, or instead of being a strong tube, it actually becomes a bit like a floppy. So instead of being a hard straw, it becomes more like a floppy ribbon. And we are unable to sort of keep our airway open at all. And that's when a lot of patients have to use a device called a BiPAP or a CPAP. That's the CPAP stands for continuous positive airway pressure. This is blowing air into your airways at a slight pressure, usually about 5 millimeters of mercury, to kind of keep that airway open to have air move in and out.
Right. And so, this is something that can definitely be evaluated. And I've had patients who were recommended to get a CPAP. And at first they were like, oh my gosh, I don't want to do a CPAP. I don't want to have this for the rest of my life. And we talked about the cycle of events. So the weight gain that led to sleep apnea, and the worse sleep apnea that then led to more weight gain. And so sometimes having that CPAP, even for a short time with really focus on weight loss, then it's to cycle out of this and get rid of the CPAP. So that would be the goal, not that now you're stuck with this for the rest of your life.
Right. And I think that the world of sleep medicine is really advancing, that the CPAP masks are different, right? So they used to kind of be these big honking masks that were on people's faces. They have sometimes nasal pillows, they call them, that are just small tubes that create a little bit of pressure in the nose, or just a little device over the nose. And of course, they still have the mask if some people prefer. And actually, some dental offices are making dental devices that can pull open the airway if a mask is something that you absolutely decline to use, and can be a good option to kind of thrust the jaw forward and sort of open up the airway enough. Again, we try to work with our patients to find the most comfortable plan for them that makes the most sense medically.
Right. But sometimes it's so important to get the sleep study and figure it out.
Yeah, I think it's funny because a lot of us don't really know that we're waking up throughout the night. And one of the most common signs can be that our sleep partners report that we're snoring or newly snoring. So if you have if someone's telling you that you're now snoring or newly snoring, if you're gaining weight itself, right? If you're like, wait a minute, I'm working with Dr. Egan, I'm losing weight, then out of nowhere, right, you're sort of slowly gaining weight. That can be a sign of obstructive sleep apnea. Actually, uncontrolled hypertension, that's elevation of our blood pressure. If you were like, I was on the same blood pressure pill for 10 years, and then all of a sudden this sort of creeped up, that can be a sign of obstructive sleep apnea. Long-term, if this goes untreated, you can put pressure on the heart, which is, God forbid, something that we want to have happen. So there are long-term consequences for not being treated for obstructive sleep apnea.
Well, and isn't even dementia a risk factor associated with sleep apnea?
Yeah, I think that is a risk factor that is associated with obstructive sleep apnea. I mean, you can imagine if your brain isn't getting oxygen, enough oxygen for periods of time, right? It can lead to sort of some chronic ischemic changes.
And again, as you talk about this, I think so many people will like be ashamed to talk about their snoring, or they're embarrassed. And you know what? So what? Shame, it doesn't matter. It doesn't work being embarrassed. Like, let's just get this out in the open and move on and use this information to help you.
Yeah. I think that I think when we think about waypoints, right, we just want to make sure we're touching base on all these different areas of health, right? And that's why we bring this up, so that we're not prioritizing one or another, and that patients come to us sort of with their own idea of what's going to make them healthy.
Exactly. And, starting with that goal, what do they want? And then we look at all these different aspects to help them figure it out.
Yeah. So let's go through our 5 take-home tips. All right. Number 1, I don't know if you've got it from what we've already said, but get your sleep, right? So the goal is 7 to 8 hours of uninterrupted sleep. A lot of us, I think, find ourselves watching maybe a little too much Netflix, right? A little too much of our devices. And so this can be a good opportunity to say, you know what, for the next week, I'm not going to do Netflix to all hours of the night. I'm going to turn off my TV, turn off my phone, and get some good sleep.
It's so important to prioritize it, because as you know, it's just all of a sudden it's midnight and the alarm's going to go off at 6 and what did I do again?
Yeah. And it's really funny because, the mechanisms by which the reason why we go through Netflix, right, isn't because it just happens to be that we're so bored, right? There's little triggers in our brain that are sort of feeding us to say, just one more, right? What can one more possibly do? So you almost have to, similar to when you're sitting down to a plate full of cake, right? You have to use your prefrontal cortex, or really kind of your Jiminy Cricket part of your brain, to say, nope, I got to go to bed. Tonight's the night. Yeah.
No, exactly. And what I finally started doing, because I always get my third wind around 10:30, I started setting an alarm to go to bed. And I just really committed to, when that alarm goes off, no matter what, I'm going to bed.
Yeah. All right, great. Tip number 2. All right. So not only does just getting enough sleep, that sort of just doesn't happen by accident. We have to put a little bit of effort in making sure that our bedroom's comfortable, right? Decluttering from some of the stuff throughout the day, buying some comfy sheets that make us feel good, making sure our bedroom isn't too hot or too cold. That can vary per person, and depending on what's going on. They actually have a recommended sleep temperature of 67 to 68 degrees, but some people like it a little bit cooler depending on what's going on. And you really want to make sure that your room is dark, right? So investing in maybe some good shades, getting your phone and the phone light out of there can really be helpful to creating a good sleep environment.
Well, I think part of it too is, once we fall asleep, if we do happen to wake up a little bit, having that dark cue helps us hopefully go right back to sleep before maybe we even notice we're awake. But if there's lights on, then it might be, it's time to wake up, and then forget it.
Right. Yep. As busy women, that flood of things kind of floods into our brain.
Right. Exactly.
Yeah. All right. Tip number 3, keep your bed for sleep and sex only, right? So that's really our prescription of what your bed is only for. No reading, no watching TV, no Facebook scrolling, right? We really would prefer it to be a situation where our bodies fall into bed and our bodies are like, this is it, right? Sleep and sex only.
Our bodies are creatures of habit. So I remember I did have a patient who was like, it's not going to change. I'm going to read in bed. It's just how it is. And I said, well, then at least could you make a barrier? Could you say, I'm going to read, I'm going to close my book, I'm going to get back up out of bed, go do my stuff, I'm going to brush my teeth, wash my face, do my stretches, and then get in bed and be deliberate about its sleep time. So I agree, it's usually best to keep it just for sleep and sex. But, if there's no way it's going to change, or a partner is going to watch TV in bed and you don't want to sleep in a different room and you're not going to change their mind, can you make an agreement to say TV off, and then again, get up, change the atmosphere, and then get in bed with the intention to go to sleep.
All right. I think that's a great plan. Dr. B, I'm putting you on the spot here. Is there any data for TV in bedrooms and sex lives?
No, but I'll do a little research.
Maybe we should look into that, right? All right. Tip number 4. All right. Find a way to declutter our minds, right? So I think we've all been there, where we're laying in bed, right? And all the things flood in from the day, as all the things for tomorrow flood in for the next day's activities. And it can be finding a good way to sort of either write a list to kind of shelve it for the night, or finding a meditation routine. It can be really helpful just to give yourself permission to let go of some of these racing thoughts in your mind.
Yeah, and that's where we talk about the gratitude piece. And gratitude is known to be the most important thing to help us get out of that flight or fight, where our brain is going and we can't stop. So even that little bit of metered breathing and gratitude before you get in the bed, or, just so it's outside of the bed again. So once you get in the bed, the body knows this is time for sleep. So It's to do that metered breathing. I always do my last stretches right before bed at night, and that's the time I do my gratitude. But my list is already made for the next day, and it's time to go to sleep.
All right. Tip number 5. So if you find yourself, despite all this, right, getting your right bedroom environment, getting the habits of using your bed only for sleep and sex, and decluttering your mind, if you still find yourself unable to fall asleep, or if it's 3 a.m. and your eyes pop back open, it's usually a good plan to get out of bed and go and create a space, maybe do some meditation or some light reading before you get back into bed again. I think the thought of just sitting there kind of tossing and turning and having our mind spinning usually doesn't end up being a productive way to fall back asleep.
Right. And people will say, I don't want to get up. And I'll just say, trust me, it works. It's truly just the minute you wake up, have a reaction of, oh, I got this. If you right away go, oh my goodness, are you kidding me? And just get all stressed out, it just feeds the fire. So it's just truly to say, nah, I got this. Get up, go to the bathroom, drink some water, have a gratitude, and then go back to bed, and hopefully you're out.
Yeah. We have a lot of kind of other tips that are sort of patient dependent, and we always love to talk to patients about finding good ways to either stay asleep, fall asleep, and kind of stay on track. All right. So if you are not in our Michigan area, here are some tips to ask your primary care doctor.
So my favorite.
Yeah.
What is my phase of ovarian function? So this is so critical because we know that people in perimenopause, in the 5 years before, around 5 years before that last menstrual period, but in perimenopause and early menopause, we know that sleep is more likely to be disrupted. It's not, again, necessarily total sleep time, but it's having interrupted sleep. So we know that sleep fragmentation or that waking up occurs. And so, if you ask your provider, what phase am I in? And if you're in perimenopause, that's the time to really look at your sleep carefully and figure out what's making you wake up. It's probably those little bit of hot flashes in the night, and hopefully get it resolved.
Dr. B, one of the things I learned from you that I really had never had anyone present to me was sometimes when women feel palpitations or that little bit of flutter in their heart, that can be kind of almost an equivalent to like a night sweat or a hot flash.
Yeah, it can be that little adrenaline that happens after a hot flash or night sweat. And even there's correlation with lower progesterone with maybe palpitations. So, as our hormones change, we're almost maybe more likely to have palpitations. But again, it can be associated with like that adrenaline rush.
And so I think that's why it's so important to know what phase of ovarian function you're in, because if you're having some of these symptoms, it can be hard to know how to treat it unless we kind of have a full understanding of where you're at.
Yeah. I had a patient who had a hysterectomy and she started having sleep disturbance, and that's what made her get checked out for perimenopause, because she wasn't bleeding, because she didn't have a uterus. And so this was her sign that something was going on.
Yeah. All right, great. Number 2, what is the treatment for night sweats?
You want to take this one? Now that you're a certified menopause practitioner.
Sure. I think one of the first things that we think about definitely is our seeds, right? Getting enough water, getting good nutrition, getting enough exercise, right? Making sure we're staying on a good sleep plan, right? To, as we've talked about all the time, and making sure we're getting enough fiber and our vitamins. I've heard you tell me that time and time again. Is our seeds.
Yes.
And then 2, kind of seeing if our patients or if you're a candidate for hormone replacement therapy.
Right. So yeah, if hormones are safe for you, then we know they're the most effective treatment for vasomotor symptoms or hot flashes and night sweats. And so, it's seeing if you're a candidate, it's asking your doctor, is it safe for me? And again, I so recommend that you see a certified menopause practitioner, be it a physician, a nurse practitioner, a PA, a certified nurse midwife, but someone who is a certified menopause practitioner to walk you through whether or not HRT is safe for you, because it is very, very effective.
All right. And what is your favorite non-hormone replacement therapy treatment for night sweats for patients who, maybe hormone replacement therapy they're not candidates for?
Right. So the second most effective is a drug. It's an SSRI, serotonin reuptake inhibitor, called Lexapro, escitalopram. So not to promote a brand, but escitalopram is almost as effective as estrogen for hot flashes and night sweats. It can also help that mind racing. It can help mood disturbance related to perimenopause and sleep disturbance. So, thank goodness we have that. In a year or so, we're going to have a new drug called elezinitant. So elezinitant is the trade name for a drug being developed by Bayer Pharmaceuticals that is going to work in the thermostat right where the estrogen works. The SSRIs work more globally. We're not as clear how that works for hot flashes and night sweats, but elezinitant is actually going to work in that same nucleus, that same thermostat that estrogen does. And it's going to be an incredibly helpful drug for women who have suffered hot flashes, night sweats, and for example, maybe they've had breast cancer or stage 2 or above uterine cancer. So again, there are lots of treatments coming forth. And so please do not suffer. There is no reason to suffer. We have lots of tricks and, tricks up our sleeve for this to really help women.
Yeah, that new drug sounds so exciting.
So exciting.
Yeah. Number 3. Do I have any habits preventing me from optimizing my sleep? I think a lot of us can attest that there are times when we're maybe eat certain things or drink certain things or have certain lifestyle habits that really prevent us from falling asleep. We sort of talked about a couple, but I think some of the big gun ones that we just have to mention is the first one's probably alcohol use. I think when we're pushing beyond 1 or 2 drinks an evening, our sleep quality really suffers.
Right. And, a lot of women will just think, well, I'm going to have a drink and that will help me fall asleep because I've not been able to fall asleep. So it might do that and help relax you and fall asleep. But then number one, as that alcohol wears off, you're going to wake up. And that's where people tend to get into trouble because then their mind races and they can't get back to sleep. And, it might be that 3 to 4 hours of sleep, you wake back up and then forget it for the rest of the night. And the alarm goes off and you just think, oh my goodness. Number 2, or alcohol itself can cause more hot flashes and night sweats. And so it's not just the sugar, it's the alcohol. And so, having that in your system can increase the chance you're going to have a hot flash or a night sweat. And that will wake you up. And then also that will disturb your sleep. So I think alcohol is probably one of the top reasons that I see. So again, please ask your physician to go over this with you.
Yeah. And I think another thing that, the more women sort of exercise and are getting some activity throughout the day, they tend to sleep better. And that's been pretty much shown in several studies. So, if you're really trying to get the body more fatigued at night to get some good quality sleep, we're really just trying to be active. It doesn't necessarily have to be, a full hour on a treadmill, but anything, even to walk outside, getting some fresh air, can really be helpful.
Yeah. So inactivity, definitely, it sounds a little counterintuitive, but inactivity actually can prevent good sleep.
Yeah. All right. Question number 4. Am I a candidate for a sleep study? So again, if you're having any signs of new snoring or any snoring at all, really, really excessive new fatigue that sort of just came out of nowhere, newly uncontrolled hypertension, which is elevated blood pressure. So even if you've had blood pressure issues before, but now we're adding more and more drugs to control your blood pressure, that could be a cue that you need a sleep study. And then, anytime anyone's really struggling with gaining weight that they don't think that they should be gaining, it'd be enough to probably get a sleep study.
Exactly. Yeah, this is so important. And so we refer patients all the time to sleep medicine specialists, and it can just be really important information to have.
Yeah. All right. Question number 5. Am I a candidate for weight loss medications? So this is obviously one of my favorite topics to talk about. So, you should really make sure that your primary care doctor that you're seeing is up to date on some of the newer weight loss medications that are out there. They really help patients lose weight by working at the brain, the liver, and the gut to sort of optimize our body's use of energy. You're a candidate for weight loss medications if your BMI is above 30 or your BMI is above 27 and you have another comorbidity such as obstructive sleep apnea or diabetes, high blood pressure, or high cholesterol levels. So if you fit any sort of that criteria, you would be a candidate for weight loss medications. And you should talk to your primary care doctor about if your insurance covers those medicines and if they feel comfortable using them. Of course, just like menopause, there are obesity medicine specialists, and they can be found at the abum.org if you don't live in Michigan, so that we can get some help from another obesity medicine specialist.
No, I love that. And I love how you talk about weight loss meds are not, what's the word? They're not excuses, or they're not like women aren't, it's not
that they're failing by using a weight loss medicine.
Yes.
Yeah. Yeah. I mean, you have to remember, we've talked about the liver, we've talked about the brain, we've talked about our ovaries. Our bodies are way complicated. And there's a bunch of different systems that are going on to keep us afloat. And sometimes when those systems go awry, some of it's not even our fault. We're all women are going to go through menopause, right? And so there's just changes to the system that we have to accommodate for. And thank God we're in a position now where we have some weight loss medications that can help us along the way.
Well, exactly. Just like we have safe hormone replacement therapy medicines. And it's not like a crutch to take a hormone medication. It's like if our ovaries stop working, it's really okay to replace that estrogen. It's not. I see so many women that say, "I just have to suffer through this. I just have to buck it up
Make
and
it to the other
get
side.
through
Yeah.
it." Why? So again, if you're not in the local area, please make sure you're asking your healthcare provider these questions.
Yeah. And as always, I think Dr. B and I, we always, one more thing we agree on is keeping patients safe. And I think if we didn't think these medications were safe, we wouldn't use them. And so we just want to keep reiterating that for women, that these are safe and effective treatment plans to make you feel better, get you to your health goals.
Exactly. And we just want you to know this information so you can make the right choices for you and feel your best. So great job,
All right.
Dr. Egan.
Thank you. And on that note, I don't know, I'm all fired up now. I don't know if I'm going to be able to fall asleep.
I think we had a busy day. It's just you're going to do the habits that you've talked about, right?
That's right. I know. I got to go do some of my gratitude thinking. Well, I'm grateful for you, Dr. B.
All right. I'm thankful for you.
All
Thank
right.
you, everyone. Stay
Yeah.
safe.